Hi, my name is Lauren Smith, and I'm the pelvic physiotherapist at Nose Creek Physiotherapy. And today's blog post is going to be a follow-up to the last video on stress urinary incontinence, looking a little bit more today at treatment and progression. So as a recap, stress urinary incontinence happens when you have an increase in pressure in the abdominal system. That's usually increased when you cough, laugh, sneeze, or jump. In terms of treatment, it really depends on the cause of the stress urinary incontinence. So with the pelvic floor, you can either have a really weak pelvic floor, which can happen after birth, so after a direct trauma, or a change in hormones, which happens usually after menopause. The other side is you have increase in tone, or you've got an overactive muscle, which tends to happen when we're under a lot of stress or our nervous system is overactive. So after a car accident, for example, which once again can create more of that tension through the pelvic floor. And then usually either that reduction in strength or that increase in tension will cause that pressurized system to work ineffectively and those pelvic floor muscles to not work as well. And so once again, treatment tends to focus either on strengthening for that weak pelvic floor or relaxing and lengthening the muscles for a system that's a little bit more active. Also, with that more tight pelvic floor, we're also helping to retrain the nervous system. So working on a lot of relaxation strategies, which will differ depending on the patient and what's going to work best for them. In terms of progression, once you're able to better use the pelvic floor muscles, so we have a little bit more strength or a little bit more length in the pelvic floor, then we're going to start incorporating some of those exercises into more functional strengthening exercises or core strength, for example, which could be a variation of a sit-up or a plank, exercises to help strengthen the obliques or those muscles on the sides. And then once we're able to better activate that with your kind of deep core structure, then we're looking at more functional activities like squats, lunges, and then eventually getting back to more plyometric exercises like running. But once again, this progression is going to look different for everyone. And the big thing is that we have to try and get that pelvic floor under control first. If anyone that you know or if you yourself is struggling with stress urinary incontinence, please reach out to us either through email or by giving us a call so we can book you in for a free discovery session, which once again will be looking at how your pelvic floor muscles are working, and we'll be discussing a little bit more with what treatment can look like for you so that you're feeling a little bit more comfortable. Once again, thank you for listening today, and I hope to see you soon. Take care.